Hi, I asked to do an unsolicited recording of my experience with Dr. Kwok and the office, and I'm absolutely happy to do so. So I just want to give you a little bit of background. I've been very good about my dental health, flossing, brushing after each meal, doing Listerine, gargle, eating very, very healthy food. I'm a vegetarian and whatever. So I was sort of shocked, to say the least, when about 7 to 10 years ago I had to undergo periodontal surgery, the traditional kind, osseous surgery, and I was just flabbergasted. They had to cut the gums and suture them and stitch them and whatever, and they did a good job, and the pockets were reduced. But I was just concerned that where did I get this, and they said that it's largely genetic in origin, so that was some comfort. And this was, again, several years ago, and over the years the pockets have gradually increased, and I had a periodontist that I liked, and he retired, and I didn't care much for the replacement, so I happened to look online, and the first time I saw a picture of Dr. Kwok, I was stunned. I had an immediate connection with him. He just looked so sweet and kind and gentle and spiritual, sincere, compassionate, everything. And that was even before I knew what a wonderful doctor dentist he is. So I made an appointment, and we talked about the difference between osseous bone surgery and the Lanap procedure with laser, and he said it's much less invasive, and would I be interested in that? And I said yes, I would. My pockets at the time were probably in the 4, 5, 6, 7, 8 range, even some 9, a couple 9s, a 10, and an 11. And he said one of my teeth, the tooth number 31, would probably have to be extracted. And it was the only time I've had an extraction since I had my wisdom teeth extracted decades ago when I was in my 20s. And so we, talked about the plan and whatever, and he told me what it was all about, explained it very, very carefully about what the two plans were, if the tooth had to be extracted, if it didn't, how he would go about it and whatever. So everything was clearly laid out. Came to the appointment that day, and I was nervous, but expectedly nervous, understandably nervous, and but it just went flawlessly. It really did. I mean, he told me at the very outset, after he had numbed me, he was able to test the tooth number 31, and he said, "Ken, I'm sorry, it has to be extracted." And so I was just flabbergasted because I didn't know what to expect. And within 20 seconds, I thought he was just probing and looking to see how, tough it was going to be to get it. He said, "It's gone." And I said, "Gone?" I didn't even feel, obviously I was numb, but still didn't feel a thing. So then he did the procedure. The whole thing took, I would guess, a couple or so hours, whatever. It was totally painless. And he put in a splint, and we had arranged to have a night guard done so that I could put that in immediately. He didn't want there to be any grinding at night and so forth. So I did that. There was virtually no pain that night whatsoever. There was no pain the next day whatsoever, none whatsoever. And the procedure was very easy, and one of the side effects of it was I was put on a liquid diet for a week, and I thought, well, that's going to be something new. And after the first day, I just didn't feel any hunger at all, and it was just such a wonderful feeling of being cleaned out, and it was almost spiritual and mystical and religious in a way. You feel so clean inside and whatever. I just loved it. So I am going to suggest to Dr. Kwok that he starts a new diet fad. The way to lose weight is to have Lanap surgery, because it's just great. I lost 6 pounds in a week. 6 pounds in a week. So that's my new guru for losing weight is Dr. Kwok. But you know, he's just a wonderful, wonderful man. He is so gentle. His bedside manner is like, on a scale of 1 to 10, it's 100. He is so sweet and gentle and kind, and he's just amazing, absolutely. And so is everyone in the office. The staff is meticulous, wonderful. So I would recommend him and the surgery and the office 100+% of the time. If you're looking for a new periodontist you can trust and respect, please look no further. Thank you. Okay, and by way of addendum, I thought about it. I don't want to seem to be so idealistic or rhapsodic about the doctor and the experience that I'm not realistic and grounded about it, because periodontal disease needs constant maintenance, and you know, I'm doing everything that I possibly can, and my goal would be to save my teeth as long as I can. The reason why he put the splint is tooth number 8 here was very loose, tremendous bone loss, deep pockets and whatever. He was very, very honest. He said, Ken, you know, there's a likelihood that you will eventually lose that tooth probably fairly soon, but we're going to try to save it. And he was very honest. He didn't say, if you have the surgery, you'll save the tooth. He said, I want to be realistic with you. So he's very ethical, very honest. And so we have saved the tooth for a whole year, and that's one of the reasons he put the splint in. And so, you know, that tooth may have to come out, and again, I'm not being unrealistic. I want to be grounded about it. And one or more of my incisors may have to go eventually, but my goal would be to meet the Lord with as many of my teeth that I have now as possible, and due to the doctor and his office, I am hopeful and confident.